Hi, my name's Neil Beck. I was a doctor, registered medical practitioner in Perth, Western Australia for 53 years. But I've learnt so much since I retired that I'm spending a lot of time, I think, helping more people in retirement than I helped when I was working. In my work, first in hospitals and then for many years as a family doctor in the suburbs, and then with my own addiction clinic for 5 years, I learned what I believe were the most important things for people to have a good life. I saw a lot of people having a bad life, and these were the things they didn't have. The 6 most important things to have a good life are mental health, good relationships, enough good relationships, high endorphins, which are over 20 chemicals in your brain that help to relieve pain and distress and manage the immune system. So the 4th thing is a strong immune system, because your immune system fights infections, allergies, inflammation, autoimmune diseases and cancers. The 5th thing is a habit of smiling. Smiling is very important. And why is that? We've got about 25 chemicals in our brain that make us feel good. And when they're normal or high, we're very happy. But if we smile or laugh, that our brain produces even more of those chemicals, and that tends to have a very good effect on us, but it has a good effect on the people around us, who may then smile, and everybody is happier and everything's better. And the 6th most important thing for having a good life is no addictions. No addictions. Addictions are a disaster. Whether it's alcohol or street drugs or gambling, whatever the addiction is, it makes your life very, very miserable. And the interesting thing, of course, is that addiction is stage 4 mental illness. When I started to work in an addiction clinic during a heroin epidemic in the late 1990s, I wanted to know what caused addiction, but I couldn't find anybody working in addiction who knew what caused addiction. But in health, if you know what the cause is, it's much easier to help people get better, and they're much less likely to relapse. If you don't know the cause, and between you and them they manage to get better, but the cause is still there, they're probably going to relapse. So what I discovered was that one day in this clinic where I was working 10 hours a week, I saw 15 heroin addicts, and 5 of them had ADD, ADHD. And when I went into it carefully, it was clear that the suffering of ADD, ADHD had driven these people to street drugs. So many people with ADD in the poorer areas where ADD is most common did not get diagnosis and did not get treatment, and in their suffering they turned to street treatments. The 3 main features of ADD are poor focusing and concentration, hyperactivity, and impulsivity. They're very impulsive. which results in making bad decisions and makes them sitting ducks for drug pushers, because the drug pushers just have to say, oh, this will get you better quickly, and they'll just grab it and take it because of their impulsivity. And I'd like to talk a little bit about blind spots, because I was staggered to find how many blind spots there were in mental health and addiction. Of course, I had blind spots to start with as well, but eventually found that the reason why mental health treatment and addiction was often unsuccessful was all the blind spots. The first blind spot was that we didn't look for causes, but you must know causes. As I mentioned, if you don't know the cause, it's much harder to get people better, and if you manage to get them better, they're probably going to relapse if the cause is still there. Why won't they? Another blind spot was that we treat everybody as if they're separate individuals, and they're not. We're most affected by our mothering, but we are very affected by our whole family, our parents, our siblings, our grandparents, and even our great-grandparents, and also by the community we live in and by the schools we go to. And there are another thing, blind spot, was that people thought only some people had mental health problems, whereas I eventually came to the conclusion that everybody has mental health problems. There are no perfect mothers, no perfect fathers, no perfect families, homes, neighbourhoods, schools. All children suffer to some extent in childhood. Some, of course, suffer terribly, and some don't suffer very much. But everybody has difficult times in their childhood, and that causes problems. And it's so much easier to treat problems if you find them early, and we must try to help our children to recover from their problems as early as possible, because mental health problems lead to more mental health problems and social problems and money problems and schooling problems. They start off with ADD. They have behavior problems in early childhood. They get to school, they have difficulty studying, focusing, concentrating. They are disruptive in the class. They cop a lot of flack. They get a bad reputation. I still remember a doctor, a very prominent doctor, who was a professor of pathology, who had a son in prison in Adelaide, and that son had ADD, which hadn't been diagnosed and had got him into crime. So he started in a good home, but he wasn't diagnosed. His father was a doctor, but a pathologist, and he never got diagnosed and treated until he got into trouble with drugs and ended up in prison. So many people with ADD end up with poor educations, leaving school early, having poor employment, having money problems, having uh, relationship problems, accommodation problems. So, I mean, that's just ADD, but everything tends to have to lead to more problems. People with depression get anxiety. People with anxiety get depression. People with post-traumatic stress disorder suffer anxiety and depression and insomnia. So early is so much easier, so much better, so much less suffering and less complications, which can end up with a person who's so complicated that they crash. In the old days, we used to say they had a nervous breakdown, and it could have been due to anxiety or depression or whatever, but they end up paralyzed and in deep trouble. And then they're usually so complicated they never get fully better. And we're not separate. We're not separate. Transgenerational trauma is a major factor. Things go from generation to generation to generation. Someone says, I won't be a drunk like my father, but they become a drunk. I won't be violent like my father, but they become violent. We used to think it was mainly genes, but it's mainly environment and epigenetics. It's which genes are switched on and which genes are switched off. We all need to know any major good or bad things that happened in our family, in our generation, but the previous generation and the previous generation and the previous generation, because those things will affect us. And often they're not talked about, they're hidden. Someone had something terrible happen to them or did something terrible, but nobody ever talks about it. We didn't know about it. My family was very adversely affected by a great-grandmother. In the early days in South Australia, in the back blocks, great-grandmother Christina had her first son when she was 16. And in the next 6 years she had 3 more sons. And then 2 years after that she had a daughter, and then another daughter, and the second daughter died. And that daughter and the daughter who died had a different father. Something must have happened to the marriage. And then finally she remarried when she was 30 and had 3 more children. And they were young when she died at 42 of cancer. And why did she die of cancer at 42? Because her immune system was depressed by all this stress and strain and suffering she had. So if you have problems, if you don't have problems, well, congratulations. I hope you're not overlooking them. But if you have problems, you need to know about what went on in the family, because people can do the same things, have the same things happen to them as have happened in the family, or the bad things that happen can cause different bad things to happen in the family. So we must look for causes, we must find causes, because that makes it much easier to get people better and makes it much less likely that they're going to relapse. We are not separate. We are affected very much by all the members of our family, most of all our mother. And there were no perfect mothers, no perfect fathers, no perfect brothers and sisters, no perfect homes or neighbourhoods or schools. So we all had some distress. And in the first year of our life, two of the most important things of our whole life were happening. The first is we were developing our emotional habits. Were we mostly happy and smiling and cheerful and optimistic, or were the problems happening in our parents' relationship? Or I still always remember 50 years ago a woman coming to see me in a broken down state because she had a baby every year for 4 years. Today, it's reckoned that if a woman has 3 children in 5 years, with all mod cons and family support, she's still at risk of stress and depression. Well, I can tell you, when I first started in practice a long time ago, a lot of people had 4, 5 or 6 children. I can still remember one woman who had 7 sons, not very far apart. I still remember one family with 9 children in a small 3-bedroom house, and it was 4 girls and 5 boys, or 4 boys and 5 girls, I can't remember which. Only 1 bathroom and only 1 toilet, and the 4 boys or girls slept in 1 bedroom, and the 5 boys or girls slept in another bedroom, and when one got sick, they all got sick. Yeah, we're very much affected, and we're kidding ourselves if we think that we weren't affected. Even today, when most people are only having 2 children. So the problem is, with all these blind spots, we've got a lot of mental health disorders going on in the community, recently made worse by the COVID epidemic, when people had to stay home because people need people, and if they can't go out and socialize, and they get worse. The kids can't go to school. That's a disaster. So we have a lot of mental health problems, and if people with serious mental health distress don't get diagnosis and proper treatment, a lot of them end up getting street treatment and become addicts. In 1 year, I treated 700 heroin addicts, 700 new heroin addicts. I had a lot of old heroin addicts as well, but 700 new patients, and a third of them had ADD. And a major problem was that because of a blind spot, in the 1970s in Perth, they separated mental health care from addiction care, and there were mental health clinics and there were addiction clinics, and the mental health doctors wouldn't see addicts. The mental health clinics refused to see addicts, and the addiction clinics treated the addiction but did nothing about the mental health, which meant that most addicts were treated with addictive medicines, because that was how you stopped them from taking the addictive substances, is to give them addictive medicines, so they have to keep coming back, getting a repeat prescription. and that created waiting lists, and people got treatment late for two reasons. One was all the waiting lists, and the other was that there's a stigma associated with mental health disorders. We thought only some people got mental health disorders. I now believe everybody has mental health disorders, more or less. Lucky ones, not too bad. But so people didn't like to admit they had a mental health problem, and there was a stigma. They didn't talk about it. They didn't ask for help till it got so bad that they had to get help or they crashed. Yeah, and the fact that everybody was getting treated late when their problems had got worse and worse, with complications making complications and things getting deeply ingrained and then needing a lot of work, just the situation just got worse and worse. And of course, once they became addicts, that made the situation so much worse. And so many people were dying. The clinic where I worked 10 hours a week, the staff were forever going off to funerals. I didn't stay there because that clinic wasn't interested in causes. And I'd realised that I had to know the cause. And what happened after I discovered that a third of the heroin addicts had ADD, and I went into it very carefully, I found that 19 out of 20 of the addicts had serious mental health disorders. There was about 8 of them, about 8 disorders. And I was just a GP, just a family doctor, not a mental health specialist. But these people couldn't get their mental health diagnosis and treatment and their addiction treatment at the same time, which is called dual diagnosis. So I started to do dual diagnosis because that's what they all needed. They all needed to have their mental health problems diagnosed and treated at the same time as their addiction was treated. And so many of them got much better. It was so much more successful. And that created a problem for me to eventually close my clinic, because the big health department clinic had a waiting list of 8 weeks. 8 weeks. Someone with suffering terribly with a heroin addiction would come to get help, and they'd come back in 8 weeks. Well, I had to sit in at that clinic to learn how to treat addiction. Really what I learned was how not to treat addiction. And less than half the people came back after 8 weeks. They all had a half-hour appointment, and about 40% of them came back, and the 60% of them were either in hospital, in prison, in a cemetery, or on the streets selling drugs to pay for their own addiction habit. Very few of them got better. But with dual diagnosis, so many of my patients got better, and I decided I would not have a waiting list. I would see everybody who came the day they came. And why was that? That was because I could see that it was critical that you saw a person with an addiction problem within 24 hours of them deciding they want to have treatment, because 36 hours after they decided they want to have treatment, their cravings got so bad that they're back on the drugs. So you have to see them. And when I saw them early like that, it was so much easier to treat them that, some days we only saw 10 addicts, but some days we saw 30. and that was a bit rush, but 15 minutes with an addict on the day they decided they wanted help was far more effective than half an hour or three-quarters of an hour or an hour on the day that suited the clinic, but not the addict. Yeah, so blind spots. Always find the causes. You can't always do anything about the causes, but it seems to help people to know what the cause was. They're very angry with their mother or their father or their drunk grandfather or someone for the influence they've had, but then when they find out how that person got their problems, they understand things, and it's much easier for them to get better. Some people just love to lay blame, and sadly that was the pretty much the attitude in the addiction clinics. When asked what caused it, they're just dickheads chasing highs. They laid blame, but the blame game is a very negative, unproductive, unhelpful thing. What you want to do is to find out the causes, and you'll find that if someone went down the drain, there was a cause for it. There were multiple causes for it usually. And of course, the more you understood causes, the more you could prevent things, the more you could treat things. So cause is very important. Looking at the whole family, treating the whole family, because nearly always the person was treated in isolation when it was a family problem. I mean, occasionally I'd have 3 people from the same family still remember a drunk mother and 2 drunk sons. Remember another very sad case. A mid-20s young man with heroin addiction. And what was his story? He came with a 40-year-old partner who was also a heroin addict. But this 25-year-old, when he was 4, his father thought his mother was having an affair, so he took the family for a drive in a car and drove the car into a tree. And it killed this 25-year-old's mother, and it killed his baby brother, and he was 4 when it happened, and he got a head injury that made him epileptic. And his father became an alcoholic after that, and he had a hell of a time and ended up a heroin addict. And in my waiting room he met a cousin the same age who was also a heroin addict, so there was obviously problems in that family. So that's how it is. Look for causes, look for reasons, and don't play the blame game. So there's a great problem that there's never going to be enough mental health care workers and addiction workers to help all the people that need help. And the worse it gets, the worse it gets, and it seems to be getting worse. In my 53 years as a doctor, I saw 2 things getting worse and worse and worse, and I'm trying to solve them both in my old age. One was diabetes, obesity, and blocked arteries. There was more and more people getting diabetes, getting obese, having blocked arteries, heart attacks and strokes and things like that. And there was more and more people getting mental illnesses, mental distresses and addictions. And there was just not enough mental health workers and addiction workers to help all the people that needed help. So a lot of people were getting no help, and almost nobody was getting enough help. And I know I'm labouring this point a bit and repeating myself, but it's just so important. The problem, the problem of the blind spots I've mentioned, but in addition to that, the problem was that mental health and addiction workers were trying to work without enough good tools. Everything we do today, we do with good tools. Everything is made easier and quicker and better by good tools. But mental health and addiction workers only had two tools, and they both had big problems. And that was why there is never going to be enough mental health and addiction care workers until we come to grips with the need for tools. The two tools with mental health and addiction were medicines and talk therapy. Medicines had two big problems. One problem was that the people who needed medicine, and medicine can give wonderful help if it's non-addictive and it's the right medicine in the right amount at the right time. But the people who make medicines want everybody to take as much medicine as possible for as long as possible, so they make so many medicines addictive. The commonest mental health disorders were anxiety, worry disorders, general anxiety, social anxiety, panic attacks, obsessive compulsive disorder, all sorts of phobias, and sleep disorders, insomnia that went along with those things. And all the medicines for those worry, anxiety disorders and sleep disorders were addictive. Originally, a long time ago, it was barbiturates, and there were many different kinds of barbiturates, and they were all addictive. And then we got benzodiazepines, much better. Yeah, Valium, Seropax, Mogadon, Xanax, they were all addictive. And then there was Ambien and Silnox, very addictive. And so many people were on medicines for years and years and years, which were addictive and which clogged up the whole system and created a lot of the waiting list problems. The other problem with medicines is they're too slow. When you swallow a tablet or a capsule, it goes right down your gut. It takes half an hour to an hour to start to be absorbed into your bloodstream and get back up to your brain, and 1 to 2 hours to be well absorbed and start to work strongly. And that's just too slow. With mental health conditions and with addiction craving, you want medicine that works very fast. And the tablets and capsules are just too slow for most cases. The medicine should work so fast that when you start to get a problem, you take the medicine that stops it. But the tablets and capsules are so slow that you've got to take them 3 times a day to prevent the problem coming. And when you take them 3 times a day, they seem to lose some of their effect, and you're on them for years and years. And the other problem with medicines, so the problem with medicines are addictive and they're too slow. And the other problem, the other tool is talk therapy, counselling, psychotherapy, group therapy, whatever, CBT, whatever you want to call it. And it had two big problems. First problem is it's so slow, so slow. You need an hour with a new patient to go right into their history, to work out what their problems are, what caused the problems, what's keeping the problems going or making them worse, to make a diagnosis and to plan treatment. And then you need to see them for half an hour to an hour every week for weeks and weeks or months and months. So it's very slow. And that just means most people don't get it or don't get enough of it. The other problem with talk therapy is it's too costly. It's too costly for two reasons. One is, to be a therapist you have to be highly qualified, and the other is you need so much time with this highly qualified person. A therapist needs to have at least a 4-year psychology degree from a university, and a lot of them have got a 7-year PhD, and the psychiatrists all have to have a 6-year general medical degree, and then a couple of years of general medicine, and then 3, 4 or 5 years of postgraduate psychiatric training. So they're very intelligent, very well educated people who've done a long training course, and they deserve to be paid well, and they need to be paid well, and if we don't pay them well, there'll be even less of them. So what was needed was more tools, a complete range of better tools. And what I did over 27 years was developed a package of 7 tools: videos, websites, a checklist, and then an app, live streaming, powder medicines, pocket powder medicine dispensers, and heartbeat meditation aids. You have to explain to everyone the nature, they have to understand what their mental health disorders are, and to understand addiction. And so many of them don't get it explained, or get it explained once and they really need to have it explained 3 or 4 times, and they don't really understand what's going on, and it's the blind leading the blind, and they just don't do well. But videos, people can watch the video over and over and over again. I started off with a 10-minute video about 12 or 14 years ago, which got 10,000 views in 9 months, but so I made a whole lot more, but gradually people stopped watching long videos and they had only watched 1-minute videos. So now I've got about 100 under a minute videos that cover each aspect of mental health, and different people have different problems, so they need to watch different videos. Then there's websites. The website's got a lot of information and the complete list of videos on it. My first website, not my first one, but the main one was mentalhealthvideos.com, but it was long and detailed and people wanted something shorter, so I ended up one called smilefixit.com. Smilefixit.com. You can see everything in one page and just tap the links and go to whatever you need. And the checklist was very helpful, because one of my assistants would do the checklist with a new patient, and the checklist had 20 questions, and I would see the result of the checklist and talk to the patient, and in 5 or 10 minutes could achieve what it took 25 or 30 or 35 minutes if I did it all myself without a checklist. But eventually apps became a thing. There was an app for everything, and we realized that we had to have a mental health app, and they're a lot of work and very expensive, but about 18 months ago we started the Mental Fix-It app. The Mental Fix-It app. Finished it about a year ago. It asks questions about every aspect of mental health and addiction and a few related social and physical matters. And each question had 3 possible answers, and you just had to read the question and choose which of the 3 answers was nearest to being right for you and tap that. So you could do 38 questions in about 10 minutes, and I thought that was fair enough. Much better than an hour consultation without the help of an app. But 10 minutes. The goal was to get people to do the app on their phones, anytime, anywhere, whenever they had time to do it. But too many people found 10 minutes too long, so we went through all the questions and managed to reduce them to 19 questions, which they could then tap their answers in 5 minutes instead of 10 minutes. But soon I've just finished revising all the questions and working out a whole new system, and our goal is for people to be able to do the app in 2 minutes. We want someone who's got a problem and a phone to be able to understand what their problems are, to understand the problems and to understand the treatment in 10 minutes. 10 minutes from the time they take their phone out. Take your phone out, find the Google Play icon or the App Store icon and press that and download the Mental Fix-It app in a few seconds. And in 2 minutes answer 12 questions. More if you want to, as long as you want, but stop whenever you want and press report. When you press report, you get an immediate report on the screen of your phone, and the report tells you which 6 1-minute videos to watch that will help you most with your particular problems, and you can watch those 6 videos in 6 minutes. But of course some people will go on answering questions for 8 minutes or 10 minutes and get a more detailed report. But when you do the check, you find that quite a lot of questions about things that you haven't got a problem with. You haven't got ADD, or you haven't got insomnia, or you haven't got this, or you haven't got... So you don't get asked those questions again. You get asked some more new questions, so eventually you cover all 33 questions. And the instant report tells you 4 very important things. It tells you, first of all, which 6 1-minute videos are going to give you the most help immediately. You can watch them immediately on your phone. The links are there. Just tap the links and watch those. Secondly, it tells you which medicines are most likely to help you, because you want to do your own homework. Consult Dr. Google and do a Google search on the medicines before you go to your doctor and get a prescription, because the best treatment is a combination of medicines and talk therapy and the other things as well. Sadly, the psychologists tend not to believe in medicines, just talk therapy, and the doctors just give you a prescription and don't do talk therapy. You need both. So, so the instant report gives you 4 things. The 6 videos that will help you most, the medicines that are likely to help you most, and the list of everything you've tapped as a problem. All the main mental health problems are asked about, and you just tap the ones that you got. You don't have everything. Well, sadly, I still remember one woman who had 5 of them, but there's about 8 common ones, and most people have got 2 or 3 or 4. And most people have got a big one. Some people got a big one and almost as big one, and 2 or 3 small ones. And the third thing the report gives you is a list of all the things that you've tapped are a problem, whether it's mild, moderate or severe, and each of those things has got a score. A severe problem like post-traumatic stress disorder to a severe degree will have a score of 15. A mild problem like mild sleeping difficulties would have a problem score of 4. A moderate problem, moderate anxiety might have a score of 8. So you then know all of your problems, and they're in order and they're scored. And the 4th thing that the instant report gives you is a total score for that day. That's all those individual scores added together into a total score, which it then puts in a graph. And when you look at your instant report, you instantly see your graph and you know whether you're getting better or not. You sort of know, but this is a much more exact way. And that's very important. That instant feedback about your progress is very important, because if you're getting better, your treatment's right. You better continue with that treatment. And if you're not getting better, that treatment is not working. And give it a bit of time. If it's still not working, your score's still not going down, you've got to change the treatment. And that instant feedback also tells you whether the things you do or that happen to you in your day-to-day living are helpful or unhelpful. If you read a book on something, or you went to a lecture on something, or you did a ChatGPT search or a Google search, and you learn something and it helped you, your score goes down, you know that was helpful. Keep going, do that some more. But if you go fishing for a weekend with some mates and get horribly drunk and your score is very bad on Monday, then you know that activity was not helpful. Don't do that again. So instant feedback from an instant report is very helpful in focusing your treatment and getting better quicker. So what else? Live streaming, which is what I'm doing now, is very helpful. A lot of people watch a lot of live streaming these days. Scrolling is one of the addictions. One of my closest friends' wife is a doctor and she's addicted to scrolling. So a lot of people learn best from live streaming. So I now do live streaming for a bit over an hour, 4 times a week. It was Wednesday, Friday, Saturday and Sunday at 7 p.m. Perth time, which is 9 p.m. Sydney and Melbourne time, but unfortunately 7 p.m. here is 7 a.m. in New York and 4 a.m. in Los Angeles and God knows what in London. So that's very user unfriendly for people in the Northern Hemisphere, and most people live in the Northern Hemisphere, and sometimes 30 or 40% of our viewers are from the Northern Hemisphere. So did they stay up very late to watch the live streaming, or did they get up very early? I don't know. But so now I do the Sunday session at 9 a.m. Perth time, which is 9 a.m. 9 p.m. New York time, maybe 8 p.m. New York time, but anyway, a much more civilized time for the Northern Hemisphere. And medicines was the fifth tool. The fifth tool, mental health and addiction medicine should be powder medicines in pocket dispensers. I found that if I ground up the tablets, medicine tablets, and gave them to people in a bottle with a little scoop, and they put the powder on their tongue and sucked it and didn't swallow it, it started to work in 5 minutes. We sort of knew that sublingual tablets worked faster, that is tablets there were a few tablets you put under your tongue, say for angina, for heart pain, but your tongue is pink or red because the blood vessels are so close to the surface, but it's even better to drop the powder on the top of your tongue rather than under your tongue, because if you drop thousands of tiny grains of powder medicine on your tongue and suck it, it starts to work in 5 minutes. And if you've got it in a pocket dispenser in your pocket, as soon as you start to feel the problem, you whiz it out and drop it on your tongue. So I developed pocket powder medicine dispensers. And it's even better than that, because we make the powder medicines taste very nice, and when your body gradually connects the very nice taste with getting better, you get what's called taste conditioning. You've probably heard of Pavlov's dog conditioning, somewhat similar thing, but what happens is that as soon as you drop the powder on your tongue and it reaches the taste buds at the back of your tongue, it starts to work even before the medicine's absorbed. It's a placebo effect, it's a real effect. It's not a make-believe effect, it's a real effect, but it happens as soon as you taste the medicine. And it's even better than that with powder, because you can put 2, 3 or 4 powders together, and if you've got 3 mental disorders and 1 addiction, you got 4 problems, and medicine that only fixes 1 or 2 of those things is not good enough. And I used to sometimes have to prescribe people 3 different tablets. And I still remember a disaster that I had. This elderly guy was referred to me by another family doctor because he was taking 17 Stilnox tablets a day, 17 very addictive sedative tablets a day. And when I went into his history, I found he had 3 or 4, I can't remember now, mental health disorders, and 1 medicine didn't work for him, especially if it was addictive. But even if it wasn't addictive, 1 medicine was not adequate for him, and I prescribed for him 3 non-addictive tablets. And he went very well for about 3 or 4 years, and then he disappeared, he lived on his own, and his son went looking for him and found him on his flat kitchen floor unconscious, and he'd been unconscious there for a while because he had taken an overdose of these medicines, and he'd had a number of overdoses before. He used to threaten his family that he'd take an overdose if they didn't do what he wanted them to do. So he was a pretty difficult customer, but he was very grateful for going very well for 3 years on 3 different tablets. But when his son found him unconscious on the kitchen floor, he got carted off to casualty in a big hospital, and in the big hospital they didn't know about addictions or mental health, the guys in casualty, but they just said 3 medicines. You can't give someone 3 medicines. So they reported me to the medical board for giving this man too much medicine, and I got fined $10,000. So we solved that problem with powder medicines, mixing 2, 3 or 4 powder medicines together, and the powder only comes out of the dispenser fairly slowly. If you're really intent on overdosing, it's a battle. You keep on putting out one dose after another. You can't just take the top off a bottle and pour all the tablets out, or pull the package apart and take them all at once. You can't really successfully overdose with powder in a proper dispenser. By the time you've taken a fairly significant amount, the earlier amount will be working, and you'll be calmed down, and you decide that you don't want to OD after all. But anyway, by combining 2, 3 or 4 medicines, we could relieve 2, 3 or 4 mental health sufferings and an addiction, and we could reduce the risk of self-harm, and the cost was much less, because 3 separate prescriptions for separate tablets or capsules is too expensive for a lot of people who are in trouble. But the powder mixtures are much less expensive, and it was also better because with powder you can get exactly the right amount for your particular case, because everybody needs a different amount of medicine. It depends on how much you weigh. Some people are 50 kilos, some people are 90 kilos, some people are 140 kilos. Your weight is a very big factor in how much medicine you need and how quickly you absorb it. Some people absorb it quicker than others. Then how quickly you burn it. Some people have got a fast metabolism that burns medicines fast, and some are slow. And it depends on how quickly your liver and your kidneys excrete the medicine. If you've got a damaged liver from alcohol, then you need a much lower dose than if you've got a normal liver. So with powder medicines, we give people a very low dose mixture, and they take 5 or 6 doses of it, and they find out how many small doses gives them the right amount. With the right amount, they get a good result, and they don't get bad side effects. If they have half a tablet or 1 tablet or 1.5 or 2 tablets and it's not enough, they don't get a good result, or if it's too much, they get side effects. But if they find the right amount with multiple small doses, then we can calculate what their best amount is and make a mixture that's the right for them in one dose. So, yeah. The seventh tool is a heartbeat meditation aid. Meditation is such a valuable thing for mental health and addiction problems. It helps people to calm down, to relax, to be refreshed, and if they do a lot of it, their brain epigenetics change and become more favourable. But the problem is that the people who most need to meditate and would benefit most from meditate often can't learn to meditate, because meditation is a habit, and habits, you make habits by doing things over and over and over again, but they have difficulty focusing, because that's what you do. You focus on a word and you just keep repeating that word, or you focus on your breathing. Breathe in, breathe out, breathe in, breathe out. And while you're focusing on the word or the breathing, you stop thinking about all your problems, and you have a little holiday, a little rest, a relaxation, calm down, relax. Except that if your problems are fairly severe and you're pretty agitated, your mind keeps on going back to your problems, because a word or your breathing, not very mind-grabbing. And I thought listening to your heart might be more mind-grabbing. I've been listening to people's hearts for 50 years, and I knew how, with a good stethoscope, how loud and clear and mind-grabbing listening to someone's heart is. And I thought, well, let's help them listen to their own heart. So I just got cheap stethoscope, cut it short. What you do, you put it in your ears like that. That's the hearing part. You put that down under your clothes, right over your heart on the left upper part of your chest, and you listen to your heart beating loud and clear, and it's quite mind-grabbing, and it's much easier to develop a meditation habit like that. And might take you a month, 2 months to get a reasonably strong habit, and then you can do it listening, focusing on your breathing, because focusing on your breathing is the best way in the end, but too difficult at the beginning for a lot of the people who most need to meditate. And why is your breathing the best thing to focus on? It's because breathing is very integrated with your mental health and mental ill health. If you notice when you're going to sleep, just before you go to sleep, your breathing gets very even, very in, out, in, out, in, out, and you're calm and you go to sleep. So steady breathing is an important thing with mental health. Even if you can't meditate, just take a few steady breaths and calm down. Very helpful. Yeah, so steady breathing is something that we should all learn to do, and we should take it further and make it part of meditation. But even if we don't get to the meditation, the steady breathing helps us. We gasp when we get a fright or something shocks us. So breathing is very integrated with your mental health, and managing your breathing is a very helpful tool. Now, I'm very old. I'm not good at technology. Recently I did a whole 1.25 hour session of live streaming and having forgotten to press the right button. So 4 of the platforms got it, but one platform didn't, because I didn't press that button. So I don't know how to talk to you directly, on live streaming, and a lot of people want to talk directly, and they sometimes want me to join their live streaming, and I don't know how to do that. I'm not even sure that you can do it, but I presume you can because they talk about it. But what I want you to do, if you will, because I'm very interested in knowing what you think and what you feel, can you please let me know your thoughts, your questions, and your criticisms of my live streaming, so I can be more helpful. And after I finish the live streaming session, which I'll do very soon, I will go through all the new followers, all the new likes, and all the comments. Sometimes there's 60 comments, sometimes there's 160 comments. Some comments I can't reply to because they're not followers, and they're and the message doesn't go through, and I don't know what to do about that. But I am very definitely interested, so please let me know, either through the platform that you use, because we look at all the platforms, or through our email address, which is healthestuff@gmail.com, healthestuff@gmail.com. That's spelt the way it sounds, but you can find it on our website, smilefixit.com. Smilefixit.com website has got links to everything, including that email address, and you can send us messages. Okay, all the best. Today is Friday. I'll be back tomorrow night at 7 p.m. Perth time, and Sunday morning at 9 a.m. Perth time.